Let's see. All right, we can start. Good evening, everyone. Hello and welcome to our public health webinar. My name is Dr. Javed Nauman. I am an associate professor at the Institute of Public Health at the College of Medicine and Health Sciences. The webinar that you all joined now is a part of a global campaign which is titled This is Public Health. We are also very proud to be affiliated with ASPER, which is an association of schools of public health in the European region. We are organizing our webinars monthly with the aim of bringing interesting speakers in order to highlight different and important public health issues. Today, in this webinar, we all will be able to ask questions. For the attendees, you can do so by clicking on the Q&A option in the middle bottom of your screen. If you see in the middle bottom of your screen, there is a Q&A option. You can write up your questions there, your comments there. If you want to talk, you can also raise your hands and ask to talk. We will give you the permission to talk. Now, allow me to introduce our speaker today. We are really honored that our invitation was accepted by Dr. Isabella, who works at the Norwegian Institute of Public Health in Norway. She is a bioethicist and a senior advisor at the Norwegian Institute of Public Health. Dr. Isabella holds a master's degree in research ethics from Keele University in the United Kingdom and a PhD in research ethics from the University of Oslo. She has, over the years, involved in several European projects in the field of genetic epidemiology and is currently working and leading a work package under the EU-funded project LifeBrain. Dr. Isabella is also the national ELSI representative of the Biobank Infrastructure, Biobank Norway, and participates in the task force for the European research infrastructure. She served as a member of the Nordic Committee on Bioethics from 2015 to 2021, and her research explores ethical and societal challenges associated with health research and the conduct of longitudinal cohort studies. Today, she is going to talk about a very exciting initiative, which is titled Global Brain Health Survey. Now, without any further ado, I would like to invite Dr. Isabella. The virtual floor is yours.
Thank you very much. Thank you for the very kind invitation. So what I will do now is share my screen so that you can see my presentation. So please let me know whether you see a full screen here.
Yes, we can see it.
Okay, thank you. So again, thank you for very kind invitation. It's a pleasure really to be able to present this work that we've been conducting for some time now. And thank you for very kind introduction. So I have one disclaimer before I start. I would like to say that I'm not a brain researcher. I was told that we might have some healthcare professionals online. My background is, as you said, in social sciences and ethics. So if there are any questions related to medical aspects of brain function or brain-related medical questions, I'm very happy to put you in contact with some of my colleagues in the project, but I will not be able to say that much about it. On the other hand, I'm very happy to be able to talk about the Global Brain Health Survey. So what I will do is that I will tell you a little bit about the project that is leading this initiative. I will say a few words about brain health as a concept, and then I'll describe the background for developing the survey, how it was set up and organized, and I will go through the main findings and some take-home messages. And what I will do is really give you a helicopter view of our results. We have a lot of results, so for the sake of time, I will really go through the main and the most important results only. So first of all, the Global Brain Health Surveys initiative led by LifeBrain. So LifeBrain is an EU project that started in 2017. So it's actually been running for 5 years now, and we are about to end the project in a few months. It includes 14 partners from 8 countries, as you see from the map here. And we also have research centers and a small and medium-sized enterprise, a lab that is helping us doing some of the analysis. So basically what the project is doing is that it is using already collected data from more than 5,000 European research participants that have been collected through 11 different European brain imaging studies. And it is using this data to identify environmental, social, occupational, and lifestyle factors influencing brain health. So it is rather a basic science project involving major research partners and universities across Europe. The project has been conducting a lot of research during the last 5 years, and some of this research has received media attention. This is just to illustrate the types of questions that the project has been looking at. We've put a lot of effort of looking at factors such as education and income, and to see what kind of impact it may have on cognition. We have also researchers working on sleep. We have researchers looking at education and how it impacts brain aging. We have also a lot of other researchers working on other aspects of brain health. And most of our findings are actually telling that brain research is a very complicated field, and that finding associations between factors and outcomes is not an easy task. So the project is very much focused on brain health. And what is brain health? Brain health is quite a new concept that has been recently launched. To our knowledge, the National Institutes of Health in the USA were one of the first to really put a definition on brain health. And that's actually the definition that we used when conducting the survey. So they define brain health as our ability to remember, learn, plan, concentrate, and handle challenges. So brain health is also about our ability to be mentally and emotionally in balance. So simply said, brain health is about making the most of our brain and taking care of it. So that was one of the first definitions that we spotted when the project started. Later, other definitions have been proposed. So there is one that has been proposed in a recent article in BMJ that states that brain health is a preservation of optimal brain integrity and mental and cognitive function and the absence of overt neurological disorders. And then more recently, the WHO has also started to put some work, to conduct some work on brain health. And the organization defines good brain health as a state in which every individual can realize their own abilities and optimize their cognitive, emotional, psychological, and behavioral functioning to cope with life situations. So as you see from these definitions, there is an understanding that brain health is related to good functioning, good cognitive and mental functioning, and good mental well-being. Actually, I should mention that the WHO is not working on a global action focusing on epilepsy and other neurological disorders. They have actually a document that is available for review on their website. And in that document, there is a lot of information about brain health and the concept of brain health. And we experienced that brain health is a concept that is also very much present in the media. So by just doing a random search on the internet, I could easily find that there's a lot of literature about brain health and what people can do to take care of their brain. There are tips, information on how to keep a healthy brain. You can download apps that provide you with exercises and plenty of information and guidance for how to take care of the brain. So this is something that also patient organizations or charities like Alzheimer's Research UK are very interested in, and that we see is getting more and more attention. So based on that observation that brain health is really on the agenda, and that our project wanted to promote brain health in populations by doing some basic science research, we decided that we wanted to know a little bit more about how brain health is perceived among populations. So what we did is that we first started with a qualitative study that we conducted in 2018. It was of relatively limited size. We talked to brain research participants in 4 European countries, the United Kingdom, Norway, Germany, and Spain. We had in total 44 participants. And we had individual structured interviews with these participants to discuss their perceptions of the brain and of brain health, to discuss their willingness to maintain a healthy brain. We wanted to know about their interest in learning about current personal brain health status using brain health tests. And we discussed that on a rather, let's say, meta level. And we wanted to know also what kind of support they would need to maintain their brain health. And what we found is that our participants were have limited familiarity with the concept of brain health. But once we started discussing it, they thought it really interesting and actually understood that a lot of factors can have an influence on brain health. But they didn't do anything specific for their brain health. They didn't take any specific actions, or if they did, they would select a very specific strategy, just like, for instance, eating nuts or doing some specific exercise or meditating. But the brain health was not part of their daily life, so to say, or not something that they were very much focused on. But they were very interested in the topic and wanted to know to do more for their brain health. So if you are interested in having the reference for this study, it is on the slide down here. So based on that, we found that this was an interesting start, and we also checked the horizon scanned the horizon for what kind of information we could find about people's views on brain health. And there have been quite a number of surveys that have been conducted before we started ours. Among others, the American Association of Retired Persons had several yearly surveys specifically looking at brain health and some aspects of brain health, connected it to nutrition or the practice of a musical instrument, etc. There have been organizations that are conducting some surveys. The ones I'm showing here are older, but after that, and after we started our survey, more surveys have come later in, for instance, in the United Kingdom or in Slovenia. So this is really something that is being investigated more and more. But we were interested in looking at perceptions of the brain and brain health in a much more international sample. And that's basically because we are an international project. So we wanted to take benefit from that. And we also wanted to look at the willingness to maintain brain health. So that's in a way the same kind of questions that we had in our interview studies. we were interested in to see how people are willing to undergo brain health tests to know more about their brain health and the kind of support they would need. So here now I'm going to tell you about 3 of these themes and present some of the results. I will not say anything about results concerning the use of brain health tests, because that's something that we are still looking at when it comes to the results. So what we did is, based on the interviews we had conducted, we developed a questionnaire, including 16 multiple choice questions and 12 demographic questions to know a little bit about the background of our respondents. We consulted with numerous organizations, including brain councils, brain foundations, research groups. We shared our draft questionnaire with participants at public lectures. We had participants in brain research that we are in contact with to get some feedback about the content of our questionnaire. And we posted that questionnaire online. It was anonymous, available for anyone above the age of 18 years, and we made that questionnaire available in 14 languages. And it took approximately 15 to 20 minutes to complete, and we did not provide any incentives for that questionnaire, for filling in that survey. So the survey was launched in June 2019 at a public event that we organized here in Oslo together with the Norwegian Brain Council, which has been really very supportive of the work that we conducted. The survey was also shared through multiple platforms. We used social media, websites, we had news articles, we had open meetings. We shared, of course, the questionnaire with participants in the Live Brain cohorts. And we also distributed postcards. So this is what the postcard looked like. And we had information also about all the organizations that helped us co-organize the survey. We also received a lot of help from 2 research registries, one called John Dementia Research in the UK and Herzenonderzoek, I'm probably not pronouncing it that correctly, in the Netherlands. So the survey closed in August 2020. That means it was open for a bit more than a year. And to our surprise, we collected over 27,000 answers across all languages and spanning 81 countries. So the map that you see here shows from which countries we received responses, but in many of these countries, we had maybe only 1 or 2 responses, while most of our respondents were located in Europe, and the 3 top countries were the United Kingdom with 36% of our respondents, the Netherlands, and Norway. And actually a majority of our respondents were recruited through the 2 research registries that I mentioned. So basically, to give you an idea, our respondents to the survey were primarily women, as you see, 71%. And most of them were either middle-aged, 41 to 60 years old, or older. Our sample had a high level of education, with 69% having achieved graduate school. Most of our participants were in married or stable relationships, 72% of them. We also asked our participants whether they could rate their cognitive health and their mental health. So this was not a medical assessment, it was a self-reported measure, so to speak. And as you can see, our respondents rated their cognitive health as average or above, very largely when it comes to that, 94%. About the same when it comes to mental health, 87%. So we had a sample with a good self-reported cognitive and mental health. About half of them had an experience as a caregiver, and about 40% had an experience of illness. We also asked our participants whether they had experience in brain research, and almost half of the sample had some experience, and about 39% of them had either employment or education in healthcare. So that means that our sample was not representative of the general population. It was a sample of women, highly educated people with good self-reported cognitive and mental health, and clearly interest in the topic. So that's important to remember when we go through the results. So the first theme that we explored then was our respondents' perceptions of brain health. And the first question we asked is, how often do you think about your brain health? And as you see from the graph here, about 45% of our respondents thought occasionally about it, 37% thought about it frequently, and women thought a little bit more about it than men, apparently. We also saw that respondents aged 41 to 60 and above 80 most often selected frequently. They had a Likert scale, as you see, a four points Likert scale they could use. So basically, this was something they were interested in. Then we also asked which factors did they think influence brain health. So if you read the graph starting at the bottom, you see that substance use was often rated as having a very strong or strong influence. If you look at the first two colors in the bar, dark and violet. And when we talked about substance use, we talked about alcohol, smoking, and drugs. Then other factors that rated quite high are genetics, physical health, sleeping habits, and social environment. Interestingly, if you look a little bit further up, you see that diet is rated a bit less often, as important, a little bit less often than the other factors. And the factors that were least often selected are socioeconomic factors like income, profession, and education. So we observed that some factors seem to decrease in terms of importance when it comes to, depending on the age of the respondents. So if you look here at the dark color, which is easier to look, you see that, for instance, sleeping habits seem to be given less weight as the respondents are older. The same applied to substance use, social environment, and diet, although the middle age seemed to put a little bit more importance on diet as compared with the youngest and the oldest ones. We also saw that some factors seem to increase in terms of importance with the age of the respondents. Life goals, that was interesting, that the older respondents seem to put more emphasis on the importance of having good life goals than the younger ones. And also the income seemed to be a factor that is given more importance with age. So basically, we see that most factors are given some importance, but with some variations, and also some demographic variations. So we also asked our respondents at what stages in life they think it is important to look after one's brain, and they could select between 6 different life periods, from pregnancy or in the womb until old age. If you look at the dark and violet colors combined, you can see that most life periods were seen as very important or important to look after one's brain, maybe with the exception of pregnancy, which seemed to be given a little less importance. And one thing I forgot to say is that we saw these differences, or we saw that the factors were more often rated as important by women, highly educated respondents, by respondents with an education or experience of healthcare. And here again, to show you by age groups, we see that there are also some differences. And maybe the take-home message from these graphs is that people seem to rate as most important the life periods that are closest to their own life periods, so to speak. Or, as you see, for instance, people that are middle-aged seem to give most importance to middle age, and the same applies to young people who give more importance to adolescence. So that was an interesting finding. Then we asked which of the following diseases and disorders did the respondents associate with the brain. So they had a list of diseases that they could select. And it is not very surprising that Alzheimer's disease ranked or was selected by most respondents. What is more interesting is that mental disorders such as schizophrenia, depression, bipolar disorder, anxiety, and addiction were selected very often, and more so than disorders such as stroke and Parkinson's, and disorders that also have an influence on the brain, such as hypertension, diabetes, and arthritis. So that was really interesting to see that mental disorders were selected that often by our respondents. So this was the questions, an overview of the questions related to perceptions of brain health. Then we wanted to ask our respondents about their interests in maintaining a healthy brain. And so the first thing we asked is, what kind of activities do they purposefully do for their brain health? And as you can see from the graph, sleeping enough, eating a healthy diet, and exercise ranked the highest, or were most often selected. As an anecdote, it is interesting to see that wearing a helmet when biking, skating, or skiing was, although as you see it from the total number of respondents, it ranked quite high. We saw some country differences. So for instance, the Norwegians were more prone to wear a helmet than people in the Netherlands, where a lot of people do actually bike. Activities that can be defined such as more like social activities, like practicing relaxing activities, socialize with people, keep a good family-work balance, ranked a little bit lower. We saw some differences also between respondents with poor self-reported mental health. They seem to be more prone to eat healthy. No, sorry, that's the other way around. So people with poor mental health were less prone to eat healthy diets as compared with people with good mental health. So we also asked people whether they would do other activities for their brain health. And as you can see from this word cloud, people then had the possibility to come up with suggestions or ideas for what they would do, they were doing. And we see that most of the activities that are described here are intellectual activities. And this is extracted from about 11,000 responses from our respondents within the United Kingdom. Then we also asked our respondents what kind of lifestyle changes they would be willing to do if they were told by their doctor that they can reduce their risk of developing a brain disease. And then we insisted that they should tell us about what they would realistically do. And as you see, exercising, relaxing more, eating healthy, diet, and stimulating the brain rank quite high. Sleep also rank quite high. That's something that we have observed all along the board. Interestingly, avoiding alcohol is at the bottom of the graph. So that's something that maybe should be followed up upon, that people are maybe a bit worried about avoiding alcohol or might find it difficult. We saw that younger people were more prone to eat more healthily than older respondents. So 80%, 87% versus 69%. And again, here we asked about other activities that people would be willing to do. And what's interesting about this word cloud is that it doesn't say that much about the activities, but it says that people basically are willing to do anything it takes to improve or maintain a healthy brain. Then we asked our respondents what would motivate them to change lifestyle to improve brain health. And the main motivation would be that they notice some problems with their brain health. For instance, that memory does not work as it used to be. A second and third motivators would be to know that the lifestyle changes are beneficial, or that it is possible to receive personal advice about what to do. And if you look at that graph, being diagnosed with a disorder was only selected by 32% of our respondents. That was a bit surprising to us. We also see that the cost of lifestyle changes was selected by only 8%, but we observed in our sample that there were some variations. So the youngest ones were a bit more worried about affordability than the oldest ones. We also asked what would prevent you from changing your lifestyle for your brain health. And the most important answers were if I cannot be sure that the changes help, or if I don't have information about what to do. So information is a key word here. Enjoyment seems also to be important. And then down on this graph, you see that lack of time was not that often selected. That was also a bit surprising to us, but some good positive news actually. Then we wanted to investigate what kind of support would be needed by our respondents to maintain a healthy brain. So we asked them to imagine that they would want to change their lifestyle to maintain or improve their brain health, and what kind of assistance would they then need. And as you see, 87% of our respondents would like to receive advice from their general practitioner or from a specialist, for instance, a nutritionist or a personal trainer. 80% would like to receive information about the effect of lifestyle changes, some kind of monitoring if they are doing some changes. And as a third choice, support from family members and friends seemed to be important, and was most important for the youngest respondents as compared with the older ones. Using a mobile app to help with brain and physical training was selected by 41% of our respondents, and to our surprise, most of our senior respondents were very positive to that, even more so than the youngest ones. Group support was also seen as interesting, and any other kind of help. And when we again asked our participants what kind of other support they would need, you see that here information is really central. Online tools might be something to explore. The financial aspects are also reported here or mentioned here. Then we asked our respondents, in their opinion, what should public health authorities do to promote brain health? And again, information comes as maybe the most important step to take. So informing the public about brain health, but also offering brain health tests free of charge to citizens. And again, I have not told you about the project, the results pertaining to the use of brain health tests, but I can shortly mention that our respondents were positive to using such tests. The respondents also see introducing relaxation activities and sports in schools and workplaces as a potential strategy. 72% of our respondents were supportive of subsidizing food and activities that are beneficial for the brain, and they were more supportive to subsidize than to raise taxes on products and healthy for the brain. We saw that there were some demographic differences between the groups. So the older adults were more concerned with preventing insurance companies from accessing brain health tests as compared with the young respondents. And the younger respondents were more in favor of subsidies than the oldest ones. We also saw that men were more in favor of taxing unhealthy food as compared to women. Well, women were more in favor of introducing relaxation activities in school and workplaces as compared with men. Finally, we asked our respondents what kind of sources they trust for information on brain health, and overwhelmingly 95% of our respondents trusted brain health specialists. Scientific journals are also highly trusted, but very well might be because of the profile of our sample that is highly educated. Interestingly, the general practitioners were also trusted, but maybe a bit more moderately than brain health specialists. And interestingly, also public researchers received moderate trust from the respondents. And then other channels, such as medical forums, radio, newspapers, were moderately trusted, and social media were the least trusted source of information. So as you see from here, there were then, as I said, less trust regarding social media, and people with education were most trustful of scientific journals. I think I already said that. So just to give you some take-home messages based on what we found in the survey, we observed that there was some awareness of the interplay between lifestyle factors, physical health, genetics, and environmental factors. But there was less emphasis on factors such as diet and socioeconomic factors, if you remember the first graphs that I showed you. Our respondents believe that all life periods are important for brain health, but they put slightly less weight on prenatal life or pregnancy. They all made the connection between brain health and Alzheimer's disease, but they also put a large emphasis on mental disorders, and more so than other disorders such as stroke or Parkinson's. So that was a very interesting findings to us. We also saw that our respondents are willing to change lifestyle for brain health, and that would mean increase exercise, increase relaxation activities, eat more healthily, do some brain stimulation activities, or try to improve sleep. But there was less willingness to avoid alcohol consumption. Symptoms and knowledge are key motivators to look after the brain, more so than diagnosis. So that was also an interesting finding, knowing that when symptoms first arise, it is in a way already too late to take action. But we observed that younger people were in general more willing to make lifestyle changes than the older ones. We also saw that respondents were in high demand of professional support and evidence-based information to take care of their brain. They were supportive of subsidizing beneficial activities and food for maintaining brain health, and brain health specialists were most trusted group of informants. So based on that, we could maybe say that it is worthwhile encouraging healthy habits before problems arise. So public health authorities and healthcare professionals might want to take some action here. to encourage people taking care of their brain as early as possible. It might be worthwhile tailoring interventions and informing about brain health in ways that are tailored or specifically for groups. We see there were some group differences in our samples in terms of responses, so tailoring information might be useful. It might also be useful linking brain health to other aspects of health. Something that we usually say is that what is good for the heart is also good for the brain. So if we could create that kind of connections, maybe it would be more natural for people to think about their brain health. Providing evidence-based information about the impact of lifestyle changes and the impact of conducting interventions might also be useful. And professionals should also be aware of the factors that can demotivate people to adopt brain-friendly behaviors and try to address them to support people as much as possible in their lifestyle choices. So most of the information that I've provided you here can be found in two reports. The report on the left-hand side is published and is available on our website. It focuses on ways to promote citizens' brain health and what public health authorities should do. The report on the right-hand side is not published yet. We are just finalizing its design, so it will come in a few days. I was hoping to launch it today, but there was some slight delay. So it is coming soon, and it provides more concrete information about what motivates people to look after their brain. So I invite you to look at our website on lifebrain.uio.no to find the report. With this, I would like to conclude. So of course, the work we conducted on the Global Brain Health Survey was the result of a large collaboration in LifeBrain. Many people have contributed, including the LifeBrain researchers. I cannot cite them all, but there were many, and people in the organizations that supported the survey, and of course, many of our respondents as well. And I'm happy to inform that the survey has now been launched in the United Arab Emirates in Arabic, and it has also been recently launched in Cuba. So we are very happy to see that the survey is having babies, and we'll be very curious to hear about the results from these other surveys. With this, I'd like to thank you for your attention, and I will stop sharing my screen.
Thank you very much, Isabella. Thank you for this excellent and honestly easy to follow talk. Thoroughly enjoyed. I would like to open the floor for discussion now. The audience can write in the Q&A section on the middle bottom of their screen. Maybe if I can start the discussion that during this process of collecting this data and the questionnaire, and now we have already launched this brain health survey in the UAE, and as you said, it is now outside of the European region, and hopefully in the coming months and the years we would involve more collaborators all over the globe. But could you identify few challenges that happened during this journey, and how in the future studies we can address to those challenges of this data collection?
Thanks for a very good question. The first thing that comes to my mind, and that I also think was maybe our biggest challenge, is collecting data from a more diverse sample. As I told you, our sample was not representative of a general population, and that was not our objective either. We knew we couldn't get a representative sample. But we had maybe hoped that we could have a more diverse sample. And there are plenty of reasons why our sample was so highly educated and mostly composed of women. It is mostly due to our recruitment strategies. We we allied with several organizations to recruit respondents, and it was very efficient, and we think that it was absolutely worth doing it. But for future surveys, I would maybe recommend trying to achieve a more diverse sample, especially trying to collect data from populations that are in low socioeconomic groups or representing different cultural and ethnic groups. I think that would be a great addition to the data that we have collected.
Yes, I think I have a comment personally. I think because this is a relatively very new concept of the brain health. Not that many people are aware of it. So maybe that might be the reasons that the responses from the diverse participants are not there. So when there, as you said in your take-home messages, if there would be more stress educating the people about the brain health, and it constantly comes in mainstream media, social media, scientific publications, then maybe people would be more aware of this concept, and then possibly, you know, it would be easier to attract people to participate in these kinds of studies. Correctly so, because still people, even where we are, you know, in the Middle East, mental health, you know, that the concept that most of the people are aware of, you know, they start to get to know about this concept now. So the brain health, I think, is relatively even very newer concept in this part of the world when it comes to that. Let me see if we have a questions. We have an anonymous person who says that the recent scientific evidence emphasize on how the gut health and brain health can't be separated. What do you think?
Well, that's an interesting question. Again, I'm not a brain researcher, so I don't think that I'm qualified to answer that question. But we certainly see in the research that my colleagues are conducting that things are interconnected. The brain is a central, how to say that, is the control room for our body. So clearly we see that there are connections between the brain and the heart and the organs and the microbiome. And so that's, I'm sorry, that's a very bad answer, but I cannot provide you with more information because this is really not my field.
I think I can add into that, because there are recent studies that shows that yes, there is a connection or the correlation between the gut health and the brain health. So maybe that's more to do what we generally eat, more related to the diet and how our bodies, you know, consume and absorb the nutrients in what we eat. And maybe that is also, it is more the general healthy profile that is related to the brain health or the mental health. But yes, overall, I think the comment, the take-home message that you have, that as there is what we already know about the heart health, because it's since the last 40-50 years, you know, we working on the cardiovascular system, and we know plenty much about the risk factors. So maybe focusing on the control, prevention, management, and control of this risk factor may help to improve the brain health also. We have questions from Professor Syed that how this survey could be applicable in the developing countries, you know, because I think now it's been done in Europe, but I guess the question is more affluent countries, as the survey participants show that, as you said, highly educated people. But now I think the UAE also an affluent country, but maybe Cuba is one of the examples, you know, where it's a less affluent countries. So maybe you can shed more light about it, that if the same questionnaire or the survey, if I understood the question well, it could be applicable in the developing countries.
Yes. So I think that it could be applicable with probably some adjustments to fit the local context and culture. The way of approaching respondents, I think, should be different. We use primarily an online approach that works very well in Europe. It might be more challenging in low and middle income countries. We allied with several civil society organizations to disseminate the survey in Europe. I would suggest, or I would recommend doing the same in other countries, because having some local anchoring is really useful. But maybe be careful about the types of organizations that you are selecting, so that you know that they are representative of the community, that they have contacts with the communities that you want to reach. So I would definitely recommend allying with local organizations, and then maybe using other platforms than simply an online platform as we did, but meeting communities where they are. And you can use either paper-based or using laptops or tablets and help people answer. But one thing we observed also when we did our interview study is that, as I said, the concept of brain health is quite new to most people. So I think they need some kind of introduction to the concept. And that's maybe something that we could have done differently as well. We did provide the NIH definition in the survey of brain health, but to most people, it still can be quite abstract. So maybe distributing the survey in connection with some public information or lecture or whatever it might be about brain health can be interesting, even though it will have an influence on the way people respond. But you can never make sure that they respond in a completely neutral way anyway. So,
Okay, we have a question from Ms. Amal, that was there any hypothesis upon which you based this survey?
We tried to be as open as possible. So we did not really use any specific hypothesis. We basically wanted to know how people understand the concept of brain health, because this was so new when we launched the survey. So we did look at previous surveys and what they found. So we expected that there would be some holes in the knowledge of our respondents, and because our sample was so highly educated, we experienced that they were quite knowledgeable about brain health. So maybe that hypothesis then was not the right one. But there were still some need for some more knowledge when it comes to specific aspects of brain health. So we tried to be as open as possible when exploring that.
Okay. Dr. Sonia is saying, thank you for a wonderful presentation. How do you propose that the results of your study would impact future public health policies?
Oh, that's a very good question that we are investigating now. So we did these two public reports that we are broadly disseminating. And basically, what we want to do now is go to public health representatives and governmental representatives and tell them about our results and put the brain health concept on the agenda. Because we realize that policymakers, decision makers are not very much aware of brain health. So of course, the context might be different from one country to another. Norway was one of the first countries in the world to implement a national strategy for brain health. It was implemented in 2017, but actually it hasn't been that much followed up, as far as I know. So we're trying then to go back to decision makers and show that now we have some more knowledge about how the public think in terms of brain health, and especially what kind of support they need to be able to take care of their brains. So we're trying to put this again on the agenda. But we would like to see it used by decision makers and by healthcare professionals as some kind of tool to create awareness around brain health.
And if I could supplement, let's say we go to these, policymakers. Could you identify one or two key areas where you would like to start working in the public domain?
Well, the first thing I think is the most obvious one, is providing information. That was also the thing that our respondents were really eager to take in. Another thing that came out both from the interview study we had and the survey is that people want to know that acting or undergoing lifestyle changes will actually have an effect. So they want to know that there is some evidence-based information they can get. They want to know that if I make the effort, it is worth it. So it's not just enough telling them that the brain is important. It's also important to tell them what to do and why you have to do it and what kind of impact it will have. Which is difficult because we don't fully understand the brain yet. So there's still a lot of research that needs to be undertaken before we can provide some concrete information. But we already know that lifestyle factors have an influence. So we already know that there are some steps that people can take to take care of their brain.
Okay, HIPAA is saying many thanks, Dr. Isabella, for interesting presentation. How could we address the ethnic and genetic differences among nations when interpreting the results?
So we did not collect any information about genetic or ethnic background of our participants, and our sample is not diverse enough to be able to provide any information about this. So I don't know, in future studies, maybe that's some information that could be incorporated in a survey. I'm a bit unsure of whether that would give you anything more, at least when it comes to genetic information. Maybe cultural or ethnic information would be more interesting to collect.
Yeah, I think for the UAE we have this extra question, when
Yes,
we're just
you did
asking
that.
about the ethnicity. So we will see, when we finalize the data collection and do the analysis if there is any impact of this extra question in the questionnaire or not. So we have a question from anonymous attendee. Thanks for the great presentation. I want to ask if the survey is available so we can use it for research purposes. Do we need any permissions to use?
Yes, so the survey is available. We have a survey protocol paper. The reference is in some of the slides, but if you do a search on the Global Brain Health Survey, you will easily find it. And in the paper, all the survey questions are listed. So it's fully feasible to use it, and we are happy to see other research groups using it. And if you want any support or assistance from us, you can take contact with us, of course, as well. But we are very happy for other groups using the survey and disseminating it. The whole point with the survey is creating awareness on brain health. So the more researchers on board, the better.
Professor Grivna is asking that the respondents trust GPs or specialists to gain information or advice about brain health. Are there any attempts to involve primary healthcare physicians or nurses in promoting brain health in some countries?
Well, the first country of course I think of is Norway, and basically we are still at that stage where the organizations that are interested in brain health, I think in particular of the Norwegian Brain Council, are trying to provide as much information as possible about brain health, also to healthcare professionals. And healthcare professionals are involved in the organization as well. I'm not aware of very specific programs or such as educational programs, for instance, that are specifically focusing on brain health. My guess would be that it is still a bit early to expect that these kind of programs exist, but that's definitely something that we would like to see in the future. So to see brain health as part of the curriculum of healthcare professionals, and some efforts are going in that direction in Norway, at least.
Okay, we have a question from anonymous attendee. Is there any data about the validity and reliability of the questionnaire?
We did our self-testing, but we don't have any published data on that. So no. So if other groups are using it, they should do their own testing, I think.
Okay. So we have a last comment from Iman. Thanks a lot for very interesting topic and presentation. All right, we are on our ending time, 8 o'clock. So if there are no further comments or questions, I would like to thank you again, Dr. Isabella, for accepting our invitation and for an excellent and very thought-provoking presentation. At the same time, I would like to thank you all those who made this webinar possible, which includes the management of our college and the university, who gave us the green light and supported the organization of this webinar. And I would like to thank you, the organizational and technical team, which includes Professor Michael Grivna, Mr. Al-Sajar from our college IT department, and Mr. Ismail from our institute, Dr. Riffat, Dr. Azhar, and Ms. Bayan. And finally, I would like to thank you all those who attended this webinar, who were present today. And for those attendees, if they want to receive the certificate of attendance, which now carries 1 CME of category 1, they can fill out the form that has been shared with you on the chat by Dr. Azhar. And finally, for the next webinar, that is going to be in 1 month's time on 22nd of March, which would be presented by Dr. Josephine from Uppsala University in Sweden. And we will get back to you with more details about that webinar. In the end, thank you very much, Isabella, for sparing time for us and providing this useful information about the brain health to all of us. And I look forward to see all of you who were present today for the next month for our next webinar. Keep well, stay safe, and goodbye.
Thank you.
Thank you so much.